Welcome to my YouTube channel. Today we are going to talk about pleurodesis. Kindly make sure you subscribe, it will cost you absolutely nothing. Pleurodesis is a combination of two words, the pleural and desis. Pleura is just the lining that covers the lungs, and it consists of two linings, the visceral and the parietal. Now between those two linings there's a space, and that space is called the pleural space. And in that space is normally a fluid that is called the pleural fluid, and that fluid usually participates in terms of lubrication, allowing expansion of the lungs. Desis means binding or fixation. So the procedure actually entails the binding of the pleural space, where it becomes there is no any space in between the pleura. So pleurodesis is a procedure performed to obliterate the pleural space to prevent recurrent pleural effusion. As I've said before, that the pleural space contains fluid, and when that fluid is excessive, it's now what we call pleural effusion or a pneumothorax. Pneumo means hair, thorax means now the thorax. So this is where you have hair in the pleural space, or to treat persistent pneumothorax. So what the procedure actually entails inflammation reaction that causes the pleural layers to bind together as previously mentioned. So the aim of this procedure is purpose of the therapy is to minimize dyspnea, patient discomfort, and the length of hospital stay and overall treatment. You find some of the diseases, for example, lung cancer, usually causes recurrent pleural effusion, and the treatment of this pleural effusion is usually drainage. So assume if your patient comes in this week with pleural effusion, assume after 2 weeks they come in with pleural effusion. So this will necessitate you to each and every time drain this pleural effusion. So just to prevent all those procedures and just to minimize the cost and to minimize frequent dyspnea and patient discomfort, doctors usually prefer to do pleurodesis, just which is one-time procedure to cover up, and it will prevent now the recurrent pleural effusions. So there are two types: there's chemical and surgical. So the chemical is where you insert a chemical after you have drained the pleural effusion. You insert a chemical such as talc, which causes the inflammation and later fibrosis and causes obliteration of the pleural space. And it can also be surgical. The indications for this procedure is usually recurrent malignant effusion, as I mentioned before, in cases such as metastatic breast or ovarian cancer and lung cancer, in addition to recurrent effusion and effusion that does not respond to drugs. The contraindication is when you have a predicted survival of less than 3 months and when you have a trapped lung. So typically, for this procedure to occur, you need to access or have physical contact with the visceral and the pleural spaces. So any disease that interfere with expansion of the lung. So for example, you have a mass or you have fibrosis that will interfere with the expansion of the lung, limiting you to oppose both the pleural and the visceral uh, pleura and the parietal pleura. So that will lead to the failure of the pleurodesis. So the next thing that we are going to talk about is the types. As you said before, we have chemical and mechanical. And in terms of mechanical, it's also called surgical. And in chemical, we say this is insertion of a sclerosing agent into the pleura via a chest tube. So after you have drained now your pleural effusion, you insert now your agent. And it includes TAC, tetracycline, silver nitrate, among other components. In terms of mechanical or surgical pleurodesis, this is a procedure done through a medical thoracotomy, and you have to visualize video-assisted thoracoscopy or open thoracotomy. So complication of this procedure, one is include fibrothorax, and a fibrothorax is a restrictive lung disease characterized by excessive pleural fibrosis causing pleural efficiency. And the etiology among pleurodesis being one of the etiology, we have others as infection, inflammation, environmental exposures. As long as these factors are going to lead to excessive pleural fibrosis. So that is one of the complications. Another complication is after you have been given the chemical pleurodesis, you may have systemic inflammation and acute respiratory syndrome have been reported in some of the patients receiving talc. Thank you.